My name is Jean Carruthers. I'm a clinical professor of ophthalmology at the University of British Columbia, and I'm an oculoplastic surgeon. I've been asked to review this very interesting paper by Dr. Guo and co-workers from the Fudan University in Shanghai, China. The paper is on the efficacy and safety of botulinum toxin type A in the treatment of glabellar lines, a meta-analysis of randomized, placebo-controlled, and double-blind trials. Drs. Guo and co-workers have conducted a stringent review of the world literature to collate the highest level of scientific medical evidence possible, Class 1, on the safety and efficacy of a single 20-unit dose of botulinum toxin type A in the treatment of glabellar frown lines. Let's look at efficacy. The traditional method of evaluating the active response to glabellar botulinum toxin has been to use the investigator facial wrinkle scale, none, mild, moderate, severe. Patient-reported outcome measures, however, are becoming much more important and essential components of judgment of aesthetic treatments. There's a similar ordinal scale used for subjects, none, slight, moderate, strong. There is a new FDA-proposed Composite Endpoint Treatment Success Scale, or CETS scale, which requires a 2-point improvement on the 4-point ordinal scale, as assessed by both the investigator and the subject. So the results of their studies: 594 papers were elicited from the Cochrane Library, Ovid Medline, PubMed, and Elsevier, from January 2002 to November of 2014. But only 7 of these were randomized placebo-controlled trials or double-blind trials, which met all the entry criteria, including a statistical analysis to ensure that there was subject heterogeneity rather than chance. A criticism of some trials has been insufficient subject numbers. This meta-analysis, however, solves this problem with 1,474 patients included, 30 of whom were lost to follow-up, and 454 of whom were in the controls. To summarize the dynamic efficacy findings, BTXA was more effective at 30 days than placebo, p is less than 0.401. When the more stringent CETS analysis was applied, the same efficacy, p is less than 0.401, and moreover, the resting efficacy findings were analyzed in 5 of the 7 studies, and p was less than 0.401. Thus, in the highest court of scientific efficacy demonstration, Class 1 evidence, the 20-unit dose of glabellar botulinum toxin A was outstandingly effective in both the active and resting phases at 30 days compared to placebo, whether looking at traditional facial wrinkle scale criteria or the new CETS proposed by the FDA. There was no difference in local adverse events between the active and placebo groups, and no systemic effects in either group. Further studies of the CETS will need to be done before recommending it as a solo new clinical trial measurement standard. Nevertheless, the CETS is a valuable way to incorporate the subject's responses as part of a more complete treatment evaluation. Finally, the statistical significance of BTXA efficacy both at rest and in the active phase, and the local and systemic safety in such a large randomized controlled patient cohort is reassuring for the study of newer treatment areas. Thank you.